We talk a lot about weight loss in individuals who have diabetes, but did you know that some of the diabetes medications can actually make you gain weight? And then, of course, there are those that can help you lose it. For those people that are living with type 2 diabetes, the difference between a medication that helps you lose weight and a medication that causes you to gain weight could make all the difference and could lead to feelings of being stuck and not seeing progress versus actually seeing some progress when you started on the best medication to help you lose weight while you manage your diabetes. So, in this video, I'm going to break down some of the medications that are available to help you lose weight, specifically when you have diabetes, and also those medications that might be adding to the weight gain in individuals who have diabetes. If you are new watching any of my videos, my name is Takova Wallace-Gay. I'm a pharmacist, and on my channel, I really want people to understand their medications. I want to talk about them in plain language so that you can hopefully take control of your medications and your health a little bit better. And today, I'm going to dive into how diabetes medications can affect your weight. The ones that are weight gainers, the ones that are kind of weight neutral, and then the ones that can help with weight loss. So I'm going to start off with the nitty-gritty, the ones that can lead to weight gain. One of the best medications that we have out there is insulin. Insulin is undoubtedly a lifesaver, but it often leads to weight gain. Why? Because insulin is a hormone, number one, but also its job is to move sugar out of your blood and into your cells. There, we can use it for energy, and we say it's stored as fat, also stored as energy. And that scale can start to creep up when you're storing sugar as fat in your cells. So if someone is on insulin and we're constantly using that to go and store sugar as fat, then that can lead to fat buildup. This does not mean that anyone is failing when they're on their treatment of insulin, and it is something that's absolutely needed. It's actually one of the harder ones for me to talk about because um, oftentimes, if you're on insulin, you really, really need it, and so we would have to find some creative ways to work with you, like potentially adding on a different medication that helps kinda counteract that so that the weight gain isn't as profound if you are someone who this is, affecting. The other thing is that when I'm in clinic, especially talking with the medical residents and some of the attending providers, I am very, very, very cautious about starting someone on insulin right out the gate. So you may have gotten diagnosed with diabetes and your A1C was really high to start and you were having symptoms like peeing a lot or very thirsty. And in that case, you may need insulin just to get your blood sugar down really quickly. But if you're young, like 40, 45, even 50, I would say we need to reevaluate that to see if this is someone who just needed insulin for that moment and they can come off of it, once we get them kind of stable, we can put them on different medications. Or is this truly someone who needs to be on insulin long term? The second class of medications that I will talk about are called the sulfonylureas. It's a long word, but the medications that fall into this family or this class are things like glipizide, glyburide, or glimepiride. And so if you're on any of these medications, their job is to push your pancreas to make more insulin. So one of my colleagues put it like this, and I really love this analogy. The sulfonylureas turn on the faucet and then they just walk away. So they tell your pancreas to start making insulin and then they don't tell it to stop. They just keep pushing on it to make more insulin. So it's kind of the same effect or sentiment behind how insulin causes you to gain weight. But in this case, we've got like this intermediate step where we're not just giving you the insulin from a shot. We're actually giving you a medication that tells your pancreas to make more insulin. And then that insulin means more storage of sugar, which again can equal to weight gain. The other thing with sulfonylureas that I will add here is that because they can cause low blood sugar, because they are causing you to make more insulin, people tend to snack more because their blood sugar starts to drop and then they start to feel hungrier. So they're snacking more and then that keeps their blood sugar levels up. And then that means that they need more insulin and the extra calories add up. And then the extra insulin coming from the pancreas adds up. And it's just this like cycle of um, unfortunate situations that can lead to weight gain. The other couple of caveats that I'll say about sulfonylureas, and I can do a whole separate video on this as well, but They are really good medications. They lower the the blood sugar pretty quickly. And they work really well for that, like really well. Um, they also help to slow things like retinopathy or eye issues and neuropathy, so, like, having tingling in the hands and feet. They help to slow that in individuals who do have diabetes, and so we have good data that shows that they help with those potential complications down the road or slow the risk of getting those complications, and so they are beneficial in that way. And the last thing I'll say about these medications is that if you've been on one of these drugs for more than 5 years or around 5 years or so, it's gonna depend on the person and, their individual body makeup, but if you've been on one for 5 years or more, that's about the time. They tend to not work as well over time just because the pancreas starts to not work as well over time. So, no matter if this drug is going to the pancreas, telling it to do something, if it's unable to perform its duties, then the drug is not gonna be able to do very much. And so sometimes when people are on sulfonylureas after about 5 years or so, they start to see their A1C or their blood sugar levels creep back up. And so the problem here is that then they the practitioner may just increase the dose or add on a medication when really, we could just take you off the sulfonylurea and give you something different altogether. The third medications that I want to talk about are in a family of medications called TZDs. They're really called thiazolidine diones. That's a long word for no reason, so we call them TZDs. There are only 2 drugs in this category, and to be fair, we don't use them a lot anymore. So if you are someone who's on one of these medications, have your clinician reevaluate if it's something that you actually need. But the 2 drugs in this class are pioglitazone and rosiglitazone. And these medications specifically work to make your body respond to insulin better, which is good to help lower your blood sugar. So it's not causing you to make more insulin or put out more insulin, but it's just allowing your body to use the insulin that you're making in a better way. Because often in diabetes, the body is resistant to the insulin that they're making. And so this allows the body to use that insulin a lot better. But the problem with these agents is that they can also cause fluid retention or cause you to hold on to water weight. And they can also increase fat storage a little bit as well. And so both of those things put together lead to weight gain. A really, 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 really important thing about these medications is if you are someone who also has heart failure, then these medications can make it worse. So we actually don't use them in people who are having symptoms related to their heart failure. But I'm usually a lot more cautious. And if the patient has heart failure at baseline, then I would recommend to use something else just because we have so many other medications that could be used. There's no need to use this one if we have other medications. All right, so those are really the 3 medications for diabetes that lead to weight gain. So that was insulin, sulfonylureas like glipizide, glyburide, glimepiride, and then our TZDs, rosiglitazone and pioglitazone. So now I want to talk about really the one medication that we call weight neutral. It's Old Faithful, the oldie but goodie metformin. And this used to be the first line medication for type 2 diabetes, but now we've got some other drugs that are, obviously y'all may have heard of that are doing a really good job with diabetes. So metformin is still a first line agent, but it's not the number one go to. But still, a lot of prescribers will start with metformin because it's familiar and it works well to lower your blood sugar. So, specifically, metformin works by lowering the production um, of sugar in the liver. It also makes the body more sensitive to insulin as well. And so, we're using insulin better. We're also reducing the amount of sugar that our liver is making because our liver makes sugar at baseline. And I'll talk a little bit about that in my video where I go over metformin specifically, and I'll link that here so that you can watch that next. But, specifically for weight, it's usually neutral and it may cause a little bit of weight loss, but that's partly because some people have a reduction in appetite and you're just using your insulin a little bit better. It's a very inexpensive agent. It has really good data, a long-standing amount of data that shows that it helps with heart issues and then, of course, also lowers the blood sugar. So metformin is a great drug unless you have some kidney issues going on and you need to talk to your prescriber about that as well or your pharmacist to help inform. then, if you don't have kidney things going on, then this medication is going to be great. Okay, finally, the medications that help with weight loss. So I'll start with the one y'all already know, GLP-1 receptor agonist. I have a whole video on those and talking about Serena's journey a little bit with coming out that she's on one. But really, I get into the nitty gritty details of what these medications do and some things to watch out for. So I will link that video as well. But these medications are really heavy hitters when it comes to weight loss. They do also mimic the natural gut hormone, makes you feel fuller, slows down your digestion and the emptying of your stomach, and also tells your brain that you're full, so it reduces your appetite. So many people are going to lose somewhere between 10 to 15% of their body weight on these medications. And when I say body weight, let me be clear, I don't mean body fat. I mean body weight. So that body weight can be fat and muscle, and it usually is, it can be up to 50% of muscle that is lost as well. And so I just want you to keep that in mind. And I'll talk about that in the other video, all about the GLP-1s. But the good thing about them is that in addition to losing weight, they also help with your heart, and they also help protect the kidneys or slow the risk of kidney disease, I should say, in people with diabetes. And so great medications. That's all I'll say about them here. We know that they help with weight by helping you lose weight. Now, the other medication that works quite well for weight loss, not as heavy of a hitter as the GLP-1s, but I really like this class of medication, and these are our SGLT2 inhibitors, and SGLT2 stands for sodium glucose cotransporter 2 inhibitors. These are the only class of medications for diabetes that work on the kidneys. All the other ones work, like in the bloodstream or on the pancreas. So these work on the kidneys. And so at baseline, our kidneys are filtering things out of our blood. And some of the things it filters, it goes ahead and lets it go out into the urine. And other things that it filters, it just cleans it up and then puts it back in the bloodstream. And so one of the things that it filters and puts back in the bloodstream is blood sugar, because we need glucose. We need that sugar for brain health and just energy, overall energy. And so the thing is, though, in individuals who have type 2 diabetes, they tend to have extra blood sugar. And so we don't really want the pancreas to be giving us back all of that blood sugar. And so what these medications do is they tell the kidneys, or they block this, transporter in the kidneys and tell it not to reabsorb or not to put that sugar back into the bloodstream and just let it flow out into the pee. And so these help us essentially pee out extra sugar. Because you are literally flushing calories, flushing sugar down the drain or down the potty, whatever. Potty. I have a 3-year-old, y'all. So, you know, it's called the potty. But because you're literally flushing those calories down, you might lose a few pounds. It's usually somewhere around like 3 to 5 pounds is the average. So if you're someone who's trying to lose a lot of weight, these may not be the best option for just like weight loss. And we don't flaunt them around like the weight loss med, but they do help lose a little bit of weight. And that's just an average. Like some people lose more than that. So just know that they can help with that. The the big thing that I love about these medications is they also really help with the kidneys. So slowing the progression to diabetic kidney disease, and they're very heart protective. So they help reduce your risk of having a heart attack. And also they are now mandatories. That's a harsh word because they're not, I mean, we can't make anything mandatory. They are strongly required and have a lot of data to suggest that they reduce the risk of mortality or death in individuals with heart failure. And that can be someone with heart failure with reduced ejection fraction or preserved ejection fraction. And I'm in my diabetes era right now with my videos, but heart conditions are another love and joy of mine. So I'm going to talk a lot about medications used for heart failure and AFib and all that in some different videos. But these medications, the SGLT2s, they do help with protecting the heart and the kidneys. And some of the medications that fall into this class are Jardiance, which is empagliflozin, or Farxiga, which is dapagliflozin. And then we also have a medication called Invokana, which is canagliflozin. we don't use that one that much anymore. You will mostly see Jardiance and Farxiga. So again, these can help you lose a little bit of weight. So altogether, just to kind of round this message out, the ones that can lead to weight gain: insulin, sulfonylureas, TZDs. Metformin is pretty neutral with maybe some modest weight loss. And then the GLP-1s and the SGLT2s are going to be the ones that help you lose weight. Please keep in mind that your response to any of these medications, just like anything, may be a little bit different than someone else's. But if you are started on one, give it a good go, give it a good try, and don't stop it or try to change it without talking to your prescriber. Sometimes the benefits of a drug really do outweigh the scale impact. And so I talked about how, for example, the SGLT2s, they are going to help protect your heart and your kidneys. And if you're someone with diabetes, we know for a fact that the heart and the kidneys are hit hard by that disease. So you want to protect them. So an SGLT2 might be a really good option to add to your medication regimen to not only help lower your blood sugar, maybe help lose some weight. And I didn't even get into how SGLT2s, because you are getting rid of fluid, can also lower your blood pressure a little bit too. But they also, are going to give you some heart and kidney protection. So a lot of benefits outside of just the scale. Um, so I hope this video was helpful. If you learned something that will help you make a smarter decision, or that will help you have a different conversation around this with your prescriber, then please hit the like button and subscribe. And I will continue to post videos that hopefully break things down in plain language for you so that you understand these medications a bit better. I also have a medication mind map. It's something that I'm going to do a whole video on soon, just how to do it. But I have a free guide, and I'll link that in the description box below. If you are on any medication, but in the context of diabetes, if you're on one of these medications, it's going to be really helpful for you to map out what that medication is, and then just be able to look at the side effects, the mechanism, what it's for, the dose that you're taking, and any notes or special considerations that you need for that medication, all in one place, and just see how all of your medications fit together. Again, just in one nice map. So if you want to check that out, download it. Again, it's free. So, there's no risk involved with that. But thank you so much for watching. I hope you got something from this video, and I will see y'all in the next one.